Can there be...
Well, welcome, folks, to this edition of the 700 Club. Unprecedented in America. 7 million people in the San Francisco Bay Area now ordered to stay home for the next 3 weeks to stop the surge of coronavirus. We're at the tipping point, the White House says. The next 15 days are critical. What other drastic measures are being taken, and will they work? George Thomas reports. Great.
President Trump is urging Americans to stay away from each other as the government releases new guidelines aimed at trying to slow the spread of the coronavirus. Those measures drastically affecting U.S. society and the economy.
My administration is recommending that all Americans, including the young and healthy, work to engage in schooling from home when possible, avoid gathering in groups of more than 10 people, avoid discretionary travel, and avoid eating and drinking at bars, restaurants, and public food courts.
Across the country, health officials scrambling to bolster testing as concerns grow that a surge in viral cases could overwhelm the medical system. In Virginia's Hampton Roads, area hospitals are increasing testing and gearing up for a potential influx of patients. Health officials here urging residents to stay home and let the virus run its course.
They don't necessarily need to come to the hospital. Many of these patients will be able to stay home and care for themselves because at this time there is no treatment for COVID-19.
All this as the nation's top infectious disease expert warns they have a 15-day window to slow the spread of the virus. The message from the White House: pay attention to the new guidelines very carefully.
We hope that the people of the United States will take them very seriously because they will fail if people don't adhere to them.
6 counties in the San Francisco Bay Area leading the way, declaring an unprecedented shelter-in-place mandate. 7 million people now ordered to stay home for the next 3 weeks.
We need to anticipate spread, but we also need to prioritize our focus.
In L.A. County, all bars, restaurants, gyms, and other businesses shut down. Grocery stores, banks, and pharmacies will remain open. It's a similar scene playing out in other states as folks line up outside stores for supplies.
I think it's probably the best thing to do right now, considering that the numbers are spreading.
On Wall Street, the Dow off nearly 3,000 points Monday on fears the virus will cause a recession.
We don't know exactly how pervasive it will be, and we don't yet have an idea of how big an impact it'll have on the economy this quarter, next quarter.
Congress is at work expecting to pass a bill later today aimed at strengthening the social safety nets for those affected by the outbreak. Up next, a bill aimed at bailing out businesses most affected by the shutdown, likely to cost hundreds of billions of dollars. The number of coronavirus cases in the U.S. now passing 4,600 with at least 86 fatalities. Health officials reported 18 deaths on Monday, the largest one-day increase since the onset of the outbreak. George Thomas, CBN News.
George, ladies and gentlemen, I want to point out one thing. This thing is having a devastating effect on the economy. Just think, Fauci said, well, we ought to close down restaurants. Okay, you close down a restaurant, so the restaurant employs 20 people. It's a small business. So those 20 people aren't going to get paychecks because the owner can't afford it. Now, how's he going to pay his taxes? What's got to be done is a massive package from the United States government that opens a facility so that that owner, at least for, say, 3 or 4 months, can get money to keep his business going. Otherwise, millions of small businesses across this nation, affecting the lives of hundreds of millions of people, will be at risk. And we can't allow that. I know the coronavirus is serious, but at the same time, we can't bankrupt people and put a whole lot of people out of work. Just think of one little business and another little business, and it all across the country. These are the ones who hire the most people. So they need to have a facility through the Fed or through the government itself, through the Treasury, which enables those people to, number one, have tax relief, and number two, have enough money that they can have available. And it should be not in terms of loans, it ought to be in terms of direct grants. That's what's got to be done. And yes, it's going to cost a lot of money, but it's going to cost the economy more if these businesses go under, we can't have that happen. Well, CBN medical reporter Laurie Johnson is here to explain the latest developments. And Laurie, healthcare officials are talking about us being at a tipping point. What does that mean?
Pat, basically it means that right now is crunch time. Think of it this way. The United States of America is standing on the edge of a cliff, and what we do in the next 2 weeks could determine whether we go off the cliff or pull ourselves back from it. Jerome Adams, the Surgeon General, who's also on the White House Coronavirus Task Force, said that right now, the next 2 weeks, the United States is at a critical inflection point where we could go one of two ways, like Italy, which is bad, or like South Korea, which is good. Right now, we have the same amount of cases that Italy had 2 weeks ago. In that time, the number of cases in Italy have exploded. And right now, people who are older are being denied care, given their last rites, because their healthcare system can't handle the number of cases. In fact, one study shows that 20% of healthcare workers in Italy have contracted the coronavirus because they don't have enough of these personal protective equipment supplies. On the other hand, South Korea took very, very aggressive mitigation techniques, and it's really, as we say, flattened the curve there. So what we do now, this is our window of opportunity, is going to determine whether we can prevent what happened in Italy from happening here.
Have you got any theory about how long this is going to take? I mean, I know the markets are wondering, is this going to be for months and months or years and years, or is it going to be just a few weeks?
Well, right now is the critical thing. The next 2 weeks is what we really need to be focusing on, and each and every American is being asked to do their part to stay home, if at all possible, and then take other preventive measures. But beyond that 2-week period, there are varying theories. Yesterday, President Trump said this might last until July or August, but clearly the critical point is for the next 2 weeks.
Why again? I mean, this thing is multiplying so fast. Or if it spreads beyond a point, we won't be able to pull the genie back into the bottle. What do you think the deal is?
That's exactly right. Now, we've talked about how the death rate is 1%, but the number of people who may require hospitalization is as high as 15%. So, we know this is a very contagious disease. They're saying now more contagious than the flu. So we really need to keep these numbers of people who catch it down, because the more people who catch it, the more they will spread it to these people who are at high risk of having complications. And that's what we're really most concerned about, the people who have complications who may require hospitalization. We have all kinds of personnel and beds and supplies for a mild to moderate outbreak, but not for a severe one.
Laurie, thank you so much. Keep us in touch. We want you to come back if you would. Thanks so much, Laurie Johnson.
My pleasure.
Now, ladies and gentlemen, there was prepared for me a study of the world that has suffered through various types of plagues, and we have that behind us, the deadliest plagues in history. And you see, going from left to right, you have the bubonic plague that wiped out, we'll look at those numbers. That was the Black Death. It took about 3/4 of the people alive, 200 million. The smallpox epidemic in 1520 was 56 million dead. The Spanish flu in 1918 took 40 to 50 million dead. The plague of Justinian, 541 BC, took 30 to 50 million. The HIV plague that we have been dealing with, the HIV AIDS, has killed 25 to 35 million. I can't even read it. The third, there's 12 million people on that. And you've got down the line 5 million, 3 million, 1.1 million, and 1 million. And the Hong Kong flu was 1 million. And the coronavirus, the cholera, it was 1 million. And we're looking at, much less than that on this particular thing. So
Yeah, hopefully we're at that place where I guess we can impact it by the choices we make.
Well,
So
apparently
let's
so.
be
But I mean,
wise.
in light of history, this is not as devastating. The Black Death just almost wiped out the whole population of Europe. I mean, there was nothing they could do to stop it, and it just kept growing, and they didn't know what caused it. It was caused by flea bites that came on these rats that had come in from Asia, and there was nothing about it. Well, as I said before, the economy is taking a huge hit from the coronavirus, but some people are making sure that workers don't miss a paycheck. Ephraim Graham has more on that.
Pat, the sports industry is stepping up to help its communities and workers who won't get paid while games are canceled. Individual players are even donating, like NBA star Zion Williamson of the New Orleans Pelicans announcing he'll pay the salaries of workers at the Smoothie King Center for 30 days. And Dallas Mavericks owner Mark Cuban has pledged to keep paying employees in the American Airlines arena.
Now that the games are suspended, they're not going to have that income, and so that just wasn't right.
Baseball and soccer players are making similar donations. The sports leagues are also donating money to help their communities, including food for children who depend on meals at school. Ohio has suspended its presidential primary. Health officials ordered the polls be closed because of the public health emergency with the coronavirus. Governor Mike DeWine tried to delay the primary, but a judge blocked his request, forcing the order. 3 other states, Arizona, Florida, and Illinois, are going forward with their primaries. Joe Biden is favored to win over Bernie Sanders in all 3 states. A shocking announcement from Iran today as state television warns the coronavirus outbreak could, quote, kill millions in that country if the public keeps traveling and ignoring health guidance. That warning came as Iran also reported a dramatic spike in the death toll, up 13%, with 135 more dead. It is just the latest example of the dramatic impact the coronavirus is having on the Middle East, from Iran to Saudi Arabia to Israel. Chris Mitchell brings us the full story now from Jerusalem.
In Mecca, the Black Stone sits alone. Saudi Arabia decided to block access to Islam's holiest site as part of its fight to stop the spread of the coronavirus. Egypt has reported hundreds of cases that severely hit its tourism industry. Jordan's King Abdullah presided over a COVID-19 meeting and implemented a compulsory quarantine for all those entering the country. Iran has been the hardest hit in the region, with nearly 1,000 deaths and more than 16,000 infected. Today, it issued its most drastic warning. It said millions could die if the public keeps traveling and ignoring health guidance.
Well, Iran is a major hotspot, and there are thousands of people there that are infected, and the estimates are that there could be tens of thousands.
Seth Frantzman maintains a daily news digest on MideastCenter.org that monitors the impact of the coronavirus in the Middle East.
We're basically seeing borders and walls going up everywhere. This is already a region that has lots of borders and walls, so that's not entirely new. But I think we're seeing, for instance, a lot of total shutdowns.
Frantzman says the economic impact on the Gulf states and Saudi Arabia will ripple throughout the world.
These are countries that have a huge role in the global economy. They knit together this kind of globalized world we live in. And all of those economies are going to suffer massively from this. And I think we need to understand that the reverberations will go on for years.
The refugees in the region are at greatest risk.
Many of them do not have access to basic healthcare needs. I think this is a test for the international community is not doing enough to help all these people who are victims of conflict.
The region might not have seen the worst of the virus and its impact on the world. Here in Israel, a research lab is working on a vaccine. Ironically, Iran's religious leaders say it will be permissible for Iranians to use that vaccine, even if it came from the Jewish state. One more sign of a changing Middle East because of the coronavirus. Chris Mitchell, CBN News, Jerusalem.
Prayers that vaccine does happen. Pat?
It's a worldwide phenomenon. It isn't just one country, and the human death toll is going to be astounding. It's going to tear the heart out of many families as they see their loved ones sick and dying. But what's happening in terms of economics is going to be devastating, and the consequences of the economic may well exceed that of the human death toll. But whatever it is just a tragedy, and I commend those pro players who are sharing and want to help, and Mark Cuban want to help those that are out of work and don't have extra income, because people are suffering. I mean, it's going to be tough. And you think of those people living out in tents in the desert. They don't have any medical supplies, and if they get this, it'll just be devastating for them. So it's something we can pray about. And, you know, and the Christian church in America needs to get together and, you know, help people, have nurses go out, have food and clothing for those who are in, you know, sheltering in place. And they need some help. And so this would be a time, it could become, what as they say, our finest hour, if we will rally to that challenge. Terry?
Well, coming up.
And welcome back to the 700 Club for this CBN News break. A cyber attack was launched on the Department of Health and Human Services computer system. The attack was related to the department's response to the coronavirus. Bloomberg News reported the attack, saying it involved overloading the department's computer servers with millions of hits, but it didn't slow the systems down significantly. The attack is believed to have come from a foreign source. Neighborhoods all over Italy are on lockdown following a surge in coronavirus cases, but that has not stopped them from finding new ways to keep their spirits up. So thousands of Italians have ventured out onto their balconies to sing with their neighbors. They're getting out the word on social media, calling on people to join in while still practicing social distancing. You can always get the latest from CBN News by going to our website at cbnnews.com. Pat and Terry are back with more of today's 700 Club. It's coming up right after this.